Alrighty, so when giving an injection of insulin, you're going to want to go through the same basic procedures like you do with the other injections. So you're going to check over the doctor's orders. You're going to want to check for any allergies the patient might have to any of that. You're going to want to check the expiration date whenever you're withdrawing it. You're going to go through all those same principles you always go through. So whenever you are going to give insulin, you're going to want to check the blood sugar beforehand, because depending on the type of insulin that you're giving, you're going to need to know the blood sugar for the sliding scale. So you can have a long-acting that you're going to give in the morning, and it's probably going to last about 24 hours. And then you could also be giving one that's going to be before meals, and so you're going to base it upon what their blood sugar is right then, and that way you check the sliding scale, which could be depending upon the hospital procedure or the doctor. It just depends. So when you're gathering your supplies for this, you're going to, with insulin, it's always going to be the orange cap, and you're not going to be able to change that needle out, so it's going to be kind of dull, so it's going to hurt a little more for the patient. So you're going to withdraw the insulin. So what we have here is the NPH, and we have a regular. So whenever giving the combination of the NPH and the regular, you're going to clean the tops of those very well. You're going to have your hands washed and everything like that. You're going to want to check the MARD 3 different times. So you're going to check it whenever you're getting it from storage, when you're preparing the medication, and then at the patient's bedside. So you're going to get all these supplies ready, and you're going to start withdrawing it. So you're going to wash your hands, clean the tops of those vials because they're going to be multi-use, and you are going to do it in the order of cloudy, clear, clear, cloudy. So you're going to inject air into the cloudy, which is the NPH. You're going to inject air into the clear, which is the regular. Then you're going to then withdraw the clear, and then you're going to go back into the cloudy, and you're going to withdraw the cloudy. So that's the order that you're going to do it. So it's going to look like this. So I'm going to be giving 5 of the cloudy. So I'm going to inject 5 units of air. Okay. And I'm going to do 5 units of the regular. So I'm going to inject 5 units of air with that. So now I'm going to withdraw, 10 units of that. You're going to withdraw 10 units of the regular insulin. You're going to expel any excess air, which there's actually not any in that. Okay, so now you're going to go over to the NPH. You're going to get the 5 units of that. And any time that you're giving insulin, you're going to have another nurse check over the amount. So I'm going to cap this needle for safe transport, and I'm going to have another nurse check that. Just going to check that. We're both going to document that. Okay, so then you're going to take this into the patient's room. You're going to already have checked their blood sugar and everything. And when giving insulin, you can give it, they give it mainly in the abdomen as a sub-Q. And so whenever you're giving that to the fatty area, you want to make sure that you're distributing it well, because if you're giving it in the same spot every single time, scar tissue will build up and it'll cause for insulin resistance. So you just want to make sure that you're giving it in places that don't have a lot of scar tissue already built up, especially because a lot of our patients are going to be long-term use of insulin. Okay, so you go into the patient's room, going to introduce self and others. You're going to check that MAR again. You're going to ask them about any allergies again, and then you're going to do 2 patient identifiers. You're going to check the wristband. You're going to scan the patient's wristband. You're going to ask them for their name, date of birth, things like that. Okay, so you're going to wash your hands. You're going to go ahead and put on some gloves. Okay, so you're going to do a quick assessment again before giving this insulin, just because it is so dangerous giving insulin. And if it is going to be like a short-acting insulin, you're going to want to make sure that patient has food right there to eat after the insulin, or else they can bottom out and go into shock. So I'm just going to go ahead and squirt this insulin out in the biohazard, because we don't want to give it in the foam. We're just going to pretend. So you're going to clean the site with the alcohol swab, and you're going to wait for that to dry. After that dries, so you're going to pinch up that area in the abdomen. You can give it at a 45 or 90-degree angle since it's a sub-Q. We're going to go ahead, so we'll give it at a 90-degree angle. They've got a lot of fatty tissue. So you're going to go ahead, and it's going to be a dart-like motion. You're going to inject that insulin. You're going to withdraw. You're going to throw it in the biohazard, and you're going to put those caps in there as well. Okay, so you're going to document after this. You're going to document that where you gave it, how many units you gave, what their blood sugar was before giving it. You're going to document how the patient was, if they had food next to them, when they were going to eat, what they were going to eat, things like that. You're going to document that you checked it and then that another nurse verified it, and I think she's going to document that as well. And then you're going to come back in a few minutes and you're going to reassess your patient and check that blood sugar again, just to make sure that they're not bottoming out, that you gave enough, things like that. So then you will document that afterwards as well. And you're gonna wash your hands, leave when you go. That's that.